Hello, this is CoronaCast, a podcast all about the coronavirus. I'm health reporter Tegan Taylor.
And I'm physician and journalist Dr. Norman Swan. It's Thursday, the 13th of August.
So, Norman, we were all waiting for the results of these phase 3 clinical trials to come through for all the vaccines that we were waiting for, and Russia's just come and just brought one out straight up. What should we make of this?
If you actually sort it all out with Russia, it's not a bad vaccine. It's a vaccine which is using the adenovirus, which is similar technology to a couple of other vaccines, such as the Oxford vaccine, not necessarily the same adenovirus. In other words, it's using a virus to help the pieces of the coronavirus to get into the body and create an immune response. And the adenovirus helps to amplify that immune response. So it's in theory quite a sophisticated vaccine. So it's not necessarily a rubbish vaccine. But probably what is rubbish is the evidence that they've got so far that it's safe and fully effective. And I certainly wouldn't be giving it to my daughter at this stage, because to really evaluate effectiveness, the phase 3 trial, and I'll just explain phase 3 trials for a moment here. There are two reasons for a phase 3 trial. One is effectiveness. Does the vaccine actually work? And interestingly, you don't necessarily need 30,000 people in a trial to find out whether it works. If you test this vaccine in, say, Brazil or a state of the United States with heaps of coronavirus around, you actually only need about 400 infections, 200 in the active vaccine group and 200 in the placebo group to find out whether it works. You need the large numbers because like it happened with Ebola and other infections, if the amount of virus goes down in the community, it's very hard to get enough exposure to test it. But if you go into a very intensely concentrated coronavirus environment, you could actually get 400 cases quite quickly. And you don't need 10,000 to find out whether it's effective. What you need 10, 20, 30,000 for is safety, because you could have a safety problem that's rare, say 1 in 10,000, 1 in 30,000, that you haven't picked up earlier. And that could be enough to spoil the vaccine's chances for getting onto market, because some of these side effects could actually be quite serious. And that's the problem with the Russian vaccine. They can't possibly have done a big enough phase 3 trial, if indeed they've done a phase 3 trial at all.
So, I mean, some experts here in Australia are calling it reckless that they've brought it out so quickly, questioning whether it's going to be given to vulnerable groups like, say, children who are immunocompromised and that sort of thing. But let's say it is a good vaccine and that does work and it does all the things that we want it to. When will we know that?
Well, you may never know that because it's not going to have a placebo-controlled trial. They're just going to go straight into practice. You may never know how effective it is, and it may never get registered outside Russia. That's the tragedy, is that they could have a very effective, very safe vaccine, but you'll never be sure because they haven't done a placebo-controlled trial.
Russia can do what Russia's going to do. What's to stop other countries from taking the same vaccine and doing a proper placebo-controlled trial elsewhere?
Nothing at all. And maybe that's the track to getting worldwide registration, is that you get a phase 3 trial elsewhere. That's exactly what could happen. And therefore, the effort of the Russian scientists would not be wasted.
In terms of effectiveness, what does that actually mean in terms of a vaccine trial?
Well, just step back. If you were to ask coronacasters about this, what do you think the purpose of a vaccine trial is? Everybody's hanging out for this because they're assuming that vaccines are going to stop COVID-19 spread. They're going to stop infection, like it does with the measles or chickenpox and that sort of thing. No. The primary outcome of most vaccine trials is actually, does it prevent COVID-19 disease? Does it change the pathway to disease and death? That's the primary outcome. And one reason for that is that it's a low bar, but it also is about nervousness at the beginning of this process about whether or not you could develop a vaccine that prevents, in the first place, a virus getting into your body through the respiratory tract. Because there aren't many vaccines that do that yet. The measles vaccine does it, and the influenza vaccine does it a bit, about 50 or 60%. But are you actually going to do that? So the hurdle was a bit lower. But fair enough, COVID-19 is a fatal disease. It's 6 times more fatal than seasonal flu. So averting those sorts of problems is significant. But does it actually prevent infection? And before you get too despondent about this, that they're not going to do that, there have been in the last couple of weeks, we haven't talked about it that much, I don't think, on Coronacast, trials in non-human primates, studies, small numbers, of some of the leading candidates here. And what they've shown is that when you give the vaccine to non-human primates, they get a pretty good and promising immune response, which is a sort of immune response you need not just to stop the disease, but actually to stop the infection, and also for the body to remember the infection when it's next exposed. And they resisted infection when, in fact, it was given to these non-human primates. So having surprised you with the primary outcome, it looks as if the secondary outcome, which is infection control, is actually going to be a realistic expectation. Whew.
So does this lower bar apply to other vaccines other than coronaviruses?
Look, there are vaccines and have been tested vaccines that are therapeutic vaccines. I think rabies vaccine, for example, is a therapeutic vaccine which affects the disease. But most vaccines are tested for the prevention of infection. I think there's a particular circumstance to do with COVID-19, the SARS-CoV-2 virus. But look, I mean, this conversation looks like it's going to be redundant because as a handy side effect of preventing disease, it looks as though they are going to prevent infection as well.
So for the purposes of us hoping that life goes back to normal, what's the difference between a vaccine that prevents infection and a vaccine that prevents disease?
The one that prevents disease is less likely to allow us to get back to normal. It means that if you catch it, it's going to be milder. Maybe fewer people end up in hospital, but it is still going to spread. And if you don't get very high coverage, like 90% plus coverage in the community, then some people will still get sick from the virus and it will continue to circulate. The one hope is that you get it down to very low levels, and that really does mean that you've got to prevent infection as well.
So is it really that a vaccine that's preventing disease is about protecting an individual, and the vaccine that's preventing infection is about getting that vaccine-induced herd immunity?
Correct.
That stops spread?
Yep. That's right.
So let's turn our attention a little bit closer to home, and Victoria, especially regional Victoria, remains a bit of a worry.
Yeah, I mean, the 7-day average in Victoria, according to our good friend Casey Briggs in ABC News, is still going down, even though the numbers are going back up to 400 or so. But if you subtract healthcare workers of all kinds, including aged care, I got it a bit wrong the other day where I thought aged care was excluded, but in fact it is included in health workers. If you subtract health workers, why it's still spreading in healthcare settings, we don't know. And regional Victoria, where Geelong, Ballarat, Bendigo are problems, then Melbourne starts to look as if it's getting much better. However, you can't ignore the fact that you've got spread amongst healthcare workers, which is unacceptable, and you've got spread in some regional centres in Victoria, and you don't want that to go on too much longer before they do something about it, more than just mandatory masks and stage 3.
The other big story in the last day or two is New Zealand, which had no local transmission for 100 days, and then suddenly a family's got it. We've got someone asking, New Zealand's got cases after 100 days of no infections. Is eradication even possible when things like this happen?
Well, you'll notice that on Coronacast we've stopped talking about eradication and elimination, and what we're talking about is zero spread. Because as long as you've got people coming in from overseas and going into hotel quarantine, you haven't eliminated the virus. It's still in your country, but you've got to keep it in hotel quarantine. I mean, the most likely thing statistically, although we haven't got the latest news as we record this on Coronacast, that it was an escape from hotel quarantine, but that's far from clear. It could very, very conceivably be that the virus was not eliminated from New Zealand and that it's been spreading quietly and silently, particularly amongst young people, and then suddenly it pops out. That's a possibility too. And there are all sorts of other rumours going around, but they've got to get to the bottom of this so that it doesn't turn into a wildfire.
So elimination of spread is still a worthy goal?
Yeah, I mean, basically, I think we should talk about zero spread rather than elimination of the virus. That's right.
Well, that's all we've got time for on Coronacast today. If you like us, why not tell a friend and leave us a review on Apple Podcasts if you can.
And if you want to ask a question, go to abc.net.au/coronavirus. Go to Ask Us Your Questions, fill in the form and mention Coronacast so we can pick it up. And you can also leave us a comment if you like. We'll see you tomorrow.
See you then.
Everyone was looking for Nicola Gobbo, the woman who became known as Lawyer X.
The woman at the centre of Victoria's biggest legal scandal.
Since going into hiding, the only interview she's done is with the ABC. And now we can tell her full story.
People were going to be murdered.
She was working both sides of the fence.
I will make a point of holding those who did this to account.